I had no pain, no issues. I wasn't ill. I've never had a symptom of any type. I just happened to feel the lump when I was putting on a pair of pants, and here we are. So it would have been September of 23, and I felt a small lump in my groin area, and within a few days I was at the doctor's office here in Pierre.
When your buddy calls you and he's concerned about a spot that wasn't there before that is progressively increasing in size, it raises your alert level just a little bit, and you think, okay, well, we need to get you in, take a look, and see what's going on. And took the lymph node out, sent it off to pathology, and then the pathologist came back with a path report showing lymphoma.
He and Scott are friends. So he said if I had to throw them out all on the table, all the lymphomas out on the table, and say I had to give you one, he said, I guess this is the one I'd choose. Because just for that reason, there's time.
Scott was able to get further workup with bone marrow biopsy, PET scan, and all of that testing showed that his tumor was localized.
It's not very often that you catch follicular lymphoma at this stage.
And so then the discussion moved into, does he need systemic treatment like chemo? For his particular cancer, the follicular lymphoma, he did not. The best chance at a cure was actually radiation.
That word radiation, I think, is scary. We just thought we have to take every chance we can get to eliminate it. Being 45 when I was diagnosed, there's hopefully a lot of time left, and just like everybody else said, here's the C word. I hope I get 6 more years. That's how much I needed to to get my daughter out of school. That was my first thought, was I need to have 6 years.
And so that's when we then did a referral to Dr. Figuera, our radiation oncologist that comes from Sioux Falls, out to Pierre.
Well, follicular lymphoma is a cancer of your white blood cells called the B cell. Basically, every cancer that we treat with radiation, there's kind of different number of treatments that we use. And typically, like for the follicular lymphoma, they're very sensitive to radiation, so they really don't need a lot. And so in his case, he had like 12 treatments.
Mentally, to not have to be in Sioux Falls, with 3 hours, you have surgery and radiation, you're just not in a good position to do the normal things that you've done. And it took until, really the springtime of 2024 before I kind of got back to my normal self, just get your stamina back and do all the things that you kind of lose after your, those kind of treatments.
Our mantra kind of became as a family, like, we're just going to do the next right thing. Like, whatever is the next right thing for us to do, for you to do, for Addie to do, for me to do, for Scott to do. We're in it together, and we're just going to do the next right thing.
Basically, he's doing very well. I mean, his last scan showed that the lymph node areas that we treated basically don't show really any evidence of disease recurrence.
And now I think our focus with him is just follow-up, surveillance. And so Scott's stuck with us for the next few years.
These aren't just patients, these are your friends, folks whose kids are involved in the same activities as your kids. You're seeing them at the river, you're seeing them camping.
And so we'll continue to follow him for the long haul, and just make sure he does okay.
I don't know if I'm through it yet. I don't know if that's why they call it a journey. In January, I'll have blood draws and my second CT scan after radiation. And then we'll start talking about what's next after that, whether you go to a year or whatever I just told the doctors, whatever you tell me to do, that's what I'm going to do. So that's what it looks like for now.